CataractCoach.com, bringing you pearls for your first LASIK surgery for resident surgeons. Today we're LASIKCoach.com. So here's the first laser. This is the Zeiss Visumax. And if you're training at UCLA, this is the laser you're going to use. And so we're bringing it in. We already have the suction ring applied to the patient's limbus. And that green flashing light for the patient to look at. And you can see the brown iris and that dark pupil will come into view, and we're getting it lined up just beautifully so. We're going to show you the whole video, the whole surgery, start to finish. There it is, touching the cornea now. Let's go down a little bit more, and then about this point, we can push the button for the instant suction. The machine tells you when it's ready, and when it's ready, you go ahead and step on the pedal. Depending on how you programmed your laser, the flap will take 18 to 22 seconds. Typically, you can see it's going from the outside in. Here's where you have patients hold very still. Let them know that green light may disappear from the center. There it goes. And now for the side cut going on there. Beautiful. When it's done, it'll automatically release just like that. And now we can switch over to the other eye. So at this point, we're switching over to the other eye. We're putting a new patient interface on the laser. And we tell the patient, hey, that was pretty easy. So you're going to be doing your first LASIK at your UCLA residency training in your senior year. And so these are the exact two lasers you will use, and you will learn from this video. We're going to show you. It's about 10 minutes or so to get both eyes done. And then now here you go. There's the new interface placed on the laser. And now we're draping and putting a speculum in the other eye. So I like to do flap, flap, and then zap, zap. So think of the two lasers, right? There's the femtosecond laser to make the LASIK flaps, and then there's the excimer laser for the ablation. So I like to go flap first for one eye, flap on the second eye, and then move the patient to the other laser. In my setup, we can just pivot the bed. You don't have to have the patient actually get up, which is very helpful. And then you use the excimer to do the actual ablation vision correction. So here we go again, lining up the patient. Again, this is all joystick control. I do this sterilely. I wear sterile gloves. We do a very serious prep. I deliver the same surgery that I would want to receive, and I want it as clean as possible, as sterile as possible. So don't treat this as a casual procedure. Treat this as the real surgery that it is. So now we start to see the eye coming into focus as we move the laser down, and we're going to dock it quite easily. And then there you go. There's the center of the pupil. Laser beautifully lined up. And right there, there's corneal touch. Push the button on the laser. It completes the suction. It tells you when it's ready. Now, it's very low suction. It's only about, 20 millimeters of mercury or so, and it's right at the limbus. And here comes the ablation. This is the femtosecond flap creation. And again, that's where the green light disappears. I like to tell patients that the light will go away. That's normal. And now the laser will do the side cut. There's the side cut. Now you can program the side cut in a myriad of different ways. You have to decide what's best for you in that situation. And I like to place it in such a way that I get a very secure LASIK flap. We've been through this for many, many years. And so now we're pivoting over to the other laser. So the screen will be black for a little bit. That's to be expected. And then the other laser, we've already pre-programmed everything. We've programmed a very carefully checked refraction and double-checked cycloplegic refraction. And we already know exactly what we want to do. We've used our nomograms to hone to get the best results. And now we're setting up over with the excimer laser. This is the excimer laser. Here's the Wavelight Allegretto. Beautiful laser. Super accurate. Been very impressed with the wavefront optimized ablations. The visual acuity from this is just spectacular. So again, the screen's blank here because we're just shifting over between beds, but I wanted to show you the whole video. There we go. Now those are the aiming beams coming from the excimer laser. So you saw a little bit of it there. And I've got some really great pearls to get this done just right. So we'll focus those two those aiming beams till it comes together. There's the eye, and now you can see that's the freshly made flap. Notice how that LASIK flap is beautifully centered over the pupil and the visual axis as it should be. You don't want it centered over to just limbus to limbus. That doesn't make sense. So here's a marker. So just making a round circular mark there, and that's going to be helpful to line up the flap edge at the end. The little white areas there of just some air, and that's normal from that interface. Now to lift the flap, I open the epithelial edge right there, just a little bit, put in the LASIK flap spreader, go across. Now notice how I don't go all the way to the bottom just yet, because I want that to hold on and keep it taut. Now at the very end, I break through there. Lift the flap up, and don't waste time here, because as soon as you lift the flap up, you have to be very consistent. You're going to start desiccating or drying out that cornea. Now there's the laser immediately in position. The tracker's on. The picture there on the top right corner is the tracker showing us that the laser is as spot on. It's got the patient's eye tracked. And this tracker is 400 or 500 hertz, very fast. And so it's very accurate. And then the ablation can be performed. And then my technician tells me when we're 25% of the way through the ablation, 50%, 75%, and at the end, treatment complete, so that I know. And so we want to keep the amount of time with that flap lifted minimized, or at least super consistent for every single case. There you go. There you can see the evidence of the ablation, which looks great. Let's get this flap back down using balanced salt solution here on a special LASIK cannula. And let's get the nice cleaning of that interface back and forth, and then we'll get the flap in good position, and that looks great. I'm going to use a Wexel that's wet, and you can use that to actually squeegee in all directions, make sure the flap's exactly where I want it. And then here's a great pearl. We're going to put on a combination drop of antibiotic, steroid. It's a suspension, so there are steroid particles. So my technician puts that for me, and I can look now with a slit beam attachment and look at all the particles in the gutter. That's how you can ensure that the drainage gutter all around there, the interface gutter, is completely identical all around. You don't want to have more pooling on one side of the flap than the other. You want it to be pretty evenly distributed. That tells you the flap is in its exact position where you want it. Let's go over to the second eye now. So one eye is totally complete. And then for the second eye, again, those are the lights of the aiming beam for the laser. And we'll do the same thing here. And as you can see, the learning curve for LASIK is a lot easier than it is for cataract surgery. Cataract surgery is a lot tougher procedure, but there are lots of subtleties in LASIK that will take you 1,000 cases to realize. But this video serves as great pearls for doing your first couple of LASIK procedures. I know you'll have a professor there teaching you, but you want to still review this video in advance. So again, lining up our aiming beams, and then there you go. You see there's the marker. So that ink mark's being placed there. It's just a circular ink mark, and then we'll wipe that ink off. Again, I'll lift just the edge of the flap here with the instrument. And then remember, as I come across, I'm going to leave the bottom part attached just to keep tension, to keep it nice and taut. So here, lift this edge just a little bit. You don't need to go much more than that. And then here comes the flap lifter. So we'll go all the way across, but not all the way to the bottom. Almost. And then coming slowly across the eye, break through, and now all the way through. Now, we've already confirmed and double-checked and triple-checked the treatment. That looks great, beautiful-looking flap, perfectly centered over the patient's visual axis. And then we've got the tracker already coming in. I dimmed the lights right now. That's why the main screen's very dark. It's easier for the patient to find that green fixation light to look at. And then the eye can simply still see, plus I know the tracker's tracking it. So I still see. So the camera doesn't pick up as well as we do. And so we're now delivering that energy. Beautifully done. And this patient, you can see in the bottom of that purple screen, it gives us a reading for the treatment in progress. So looking great and all set. I get the tracker out of the way. And now we can get that flap nicely positioned. Flip the flap back over. There it is. And then the treatment we're doing here is a 6.5 for most of the treatment, and then it's a blend zone out to 9 millimeters. So 6.5 millimeters the center, 9 millimeters periphery. Again, flap goes down very nicely. Now squeegeeing it with the wet Wexel, and then I'll put that suspension of antibiotic and steroid, and then we'll look with our slit lamp beam attachment to make sure everything looks great. Patient will then go rest for 15 minutes, and we'll examine them at the slit lamp in one of the exam rooms. That looks beautiful. So good luck on your future LASIK. You can do it. Thanks for watching these videos. And remember to go to CataractCoach.com and sign up for a free daily email. We'll send you an email every day with a great video like this and other surgical pearls that'll make you a better surgeon.